Everybody, good afternoon and welcome to our weekly media briefing and public health update with Montgomery County Executive Mark Elridge. I'm Lorna Virgili, Hispanic Public Information Officer. Welcome, good afternoon. And joining us today is Montgomery County Health Officer Dr. Keisha Davis, as well as Mr. Sean O'Donnell, who is Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services. Dr. Earl Stoddard, our Assistant Chief Administrative Officer. And today we have a special guest. This week, our special guest is Maryland State Delegate David Frazier Hidalgo. Thank you for joining us, Mr. Delegate. And members of the media, remember to use the chat during the Q&A portion of this presentation. With that, good afternoon to you, Mr. County Executive.
Good afternoon, and thank you all for joining again today. I want to start by just acknowledging that this is National Administrative Professionals Day. I want to thank the hundreds of administrative professionals who manage the operations of this government. I appreciate their long hours and the extra effort they give and dedication they show to serving the public, and especially their service during COVID. I want to specifically thank the administrative staff here in the County Executive's office. This office is always a whirlwind of activity, and through it all, they provided stability, continuity, and really exemplary service. So I hope administrative professionals throughout the county are showered with gratitude today. Earth Month is winding down, but combating climate change is a top priority for us every day. And today I wanted to take a moment to talk about and update you on some of the actions we have been taking to meet our climate action plan goals. Climate change is an existential threat, and unfortunately, it doesn't get the kind of attention that it needs in the media. For example, MoCo 360 has published over 80 articles this month in the county. Only 2 were about the environment and sustainability issues. And this is Earth Month. And there's a lot of federal money out there. There are funds available for the state, and people just aren't getting informed. And I think we need to continue to step up our efforts to let people know what's available to help them make a transition to clean energy. If we're going to see progress on combating climate change, this subject needs to be as much a priority for the media as it is for us in government. And I'm a firsthand experiencer of this. I have an electric vehicle, and I've put solar panels on my house, and the savings from my solar panels are real. And just last month, my savings were the equivalent of 2 months of payments for my solar panels, plus the alternative energy I use from a solar farm that supplements the electricity produced by my panels. I'm not an unusual story. I'm a pretty typical case. In fact, my solar array is less than would have fully covered my house's needs because I am surrounded by trees. And there are just many, many, many rooftops in Montgomery County that could be doing this now and saving themselves money. It will pay for itself. And there's lots of evidence out there now that that's exactly what will happen. At this moment, communication is the key as we're in a period of great transition for our residents and businesses to change habits, utilize new technologies, and implement best practices in their personal lives. And facts are facts. And according to NOAA, currently humans are putting an estimated 9.5 billion metric tons of carbon into the atmosphere each year by burning fossil fuels, and another 1.5 billion through deforestation and other land cover changes. Since 1750, humans have increased the abundance of carbon dioxide in the atmosphere by nearly 50%. Maintaining the status quo is not going to cut it anymore. And if we want our kids and grandkids and great-grandchildren to grow up in a better environment, not a worse environment, we have to begin addressing climate change challenges now. And I'm proud that Montgomery County is leading the way. Last week in Gaithersburg, Governor Moore joined us in celebrating our Green Bank's largest rooftop solar project on an affordable housing complex. And at this event, the governor noted, quote, "This is a time where we see Montgomery County is going to lead. There are certain places that are right now debating about what progress looks like. They are in the process of figuring it out. How do we get there?" And then there's Montgomery County saying, "We'll see you at the finish line." I was really glad to see that the governor acknowledges the work we're doing, and he's made, change an important part of his climate efforts. The ultimate climate goal of our climate action plan is to achieve 100% carbon emission reductions by 2035. And specifically, we've committed to the following solutions over the next 4 years: providing funding for buildings to transition from gas to electric, electrifying and retrofitting our county buildings and fleet for energy efficiency, expanding the collection of food waste countywide and moving to composting, expanding the implementation of solar on rooftops, parking lots, and fields, financially assisting marginalized communities most often impacted by climate change to transition to clean energy, and shutting down the incinerator, which is both a public health and climate change threat. Additionally, we're not just focusing on policy ideas, but we're investing in both operating and our capital budgets. My FY24 budget includes recommendations for $272 million of funding in both the operating and capital budgets that will go toward our efforts to combat climate change. And today I want to focus on 2 positions recommended in our budget as examples that will help both residents and businesses better navigate the options and requirements for electrification and solar power. These positions make it easier for residents and business owners to take advantage of programs already in place to go green. We can't just assume that because we're passing laws or enacting new policies that our residents will simply understand and get in line. We need to help them navigate this transition, assist those who may need financial assistance, and answer their questions and concerns. As somebody, who went through the process of shopping for solar panels, knowing other people have done the same, it is a very complex world, and a lot of the information isn't clear. One of the things we hope to do is to make it clearer for residents so they can evaluate what bids are and what is included in bids, so they can make apples to apples comparisons as they make an effort to move toward solar energy. The budget also includes money to advance community choice energy, climate grants for community organizations, and for the management of an electric vehicle purchasing co-op. It also included more funding to plant shade trees. And in March, we planted our 10,000th tree since launching Tree Montgomery. We also included additional funding to identify and address the illegal discharge of pollutants in our waterways throughout the county, and to ensure the county's stormwater management structures are inspected and maintained. And frankly, many of them are going to have to be upgraded. The amount of water we're seeing in these storms exceeds the capacity of many systems that were installed in the county a decade or 2 ago. And we're looking at the need to increase the performance of these systems to handle the kind of storms that we're seeing now. And I want to be clear, none of this is easy. We have to be deliberate about what we're doing, and we have to engage and educate our communities. The good news is the county has an overwhelming majority of residents who care. This is not something we take for granted in a nation filled with climate deniers and consistent misinformation being propagated by the fossil fuel industry. We're also fortunate to finally have leadership in the White House and in the governor's office in Annapolis who get it. After years of dealing with both the Trump and Hogan administration environmental policies, we now have more resources and support today than just a couple of years ago. I'm pleased to be joined today by State Delegate David Fraser-Hidalgo to talk about the efforts being made by him and the state lawmakers to help us fight climate change. Delegate Fraser-Hidalgo is considered a green champion by the Maryland League of Conservation Voters for his work on improving the Chesapeake Bay, his efforts to ban fracking, and support for alternative energy. And he and I both drive electric cars. I think we both have solar roofs, and I'm sure that's not where our similarities end. So let me turn it over to him, and we'll take questions from the media about our sustainability efforts after he speaks. So David, it's all yours now.
Thank you. Thank you, Mr. County Executive. Thank you for having me here to talk a little bit about what we've done. I think it's important to go back in time just a little bit and talk about the last legislative session, the 2022 session, because that sets the groundwork for the 2023 session. and a little bit before that. So I'm proud to say that the state is doing a great job moving the needle. Last legislative session, 2022, we passed the Climate Solutions Now Act, which provided goals and funding that was really revolutionary across the country. And the great thing is that's where the state is moving. And the other great thing about it is that Montgomery County, in a lot of ways, is already moving that way. I was at the groundbreaking last week in Gaithersburg and listening to the governor speak. I've heard him speak so many times on these issues, as well as the county executive. And it's so wonderful to see how far we've come. One of the examples is a few years ago, the county executive was talking about electrifying the school bus fleet. And I had been working on a bill to do just that for years, trying to find a combination that could get passed. And in the meantime, we had conversations, and the county executive decided this is what he wanted to do. He worked very hard, very quickly, and is now in the middle of converting 1,300 school buses. Last year, we school buses to electric. Last year in the Climate Solutions Now Act, we actually are allowing the public utilities to get involved in that as well. But Montgomery County is already, again, leading the way and is already off to the races. And I think there's well over 50 school buses at this point. And within about 10 years or so, maybe less, we'll have more like 1,200 school buses converted. That's one example. The batteries on those school buses are very important to understand how those work, but those batteries help with peaker plants, and that's what you need to kind of off-put the amount of fossil fuels that are burned, especially in summer months when there's peak demand. That's just one example. Another example is that the state actually got $5 million to go to the county this year to help with the conversion of transit buses to fully electric. Something, again, that the county already had a ribbon cutting on, I think, 1.5 years or 2 years ago in Silver Spring, the first fleet transition. So those are a couple of things that just to kind of set the stage for where we are. Where we've been to where we are going. This year was another very busy year coming off of Climate Solutions Now last year, which was a really big lift. We have community solar project, community solar program that the county executive had mentioned. And this particular program takes it out of a pilot program and makes it a permanent program for the counties around the state. This is extraordinarily important because it sets the groundwork for communities to feel safe and comfortable, both on an environmental and particularly a financial perspective, to move forward with community solar. It also provides incentives for underserved communities. That's one piece. We also did offshore wind, which is something that's been languishing in the previous administration for years. This will allow for the acceleration of offshore wind development off the coast of Maryland. And this will be a huge piece, jobs for Marylanders, and again, getting away from the burning of fossil fuels. A bill that I had that also passed was an energy storage bill, and it sets goals of 3,000 megawatts of storage for the state by 2033. And this is important because I think the holy grail everybody has thought of is generating electricity, which is true. But the other part about it is storing it so that we can use it on the cloudy days, or use it on the non-windy days, or use it in the middle of the night. So that bill passed as well as the other two bills that I mentioned. Those are important for setting the groundwork and making sure investors come to Maryland and are willing to invest in electric storage, in wind, and in solar. Those are all really big pieces. I want to circle back a little bit to electric vehicles because we did a lot on the electric vehicle front as well. Maryland is part of the zero emission vehicle program that was established by California in 2007. I'm happy to say that this year, the governor went ahead and jumped on board with all EVs in the state of Maryland by 2035. Again, Montgomery County is already going in this direction, purchasing fleet vehicles. But this will mean that all vehicles by 2035 that are sold in Maryland will have to be electric. It's just going on doing the same thing that California is doing. The previous governor, Governor Hogan, refused to promulgate regulations for that. Governor Moore has said since promulgated regulations for that, and that's important because it says to the manufacturers, we want EVs in Maryland. So I think that's an extremely important piece, which is what we did. We also had NH to promote electric vehicles, because for those that don't know, as far as greenhouse gas emissions are concerned, the transportation sector is about 33% in the state of Maryland of contributing to greenhouse gas emissions. So the faster we move in that direction, the better. We have goals to meet in the state. And we're getting there. I think we're at probably about 65,000 electric vehicles registered in the state of Maryland now, and that's accelerating very, very quickly. We redid the HOV sticker. So if you have an EV, you can drive in the HOV lanes once you get this sticker. That expired last year. The bill passed this year. So we'll move forward with that. There's also some electric vehicle infrastructure charging programs to help to provide charging in underserved communities where maybe private companies wouldn't want to do it. It allows utilities to go in and do some of that charging. There are some other things as well. I think those are really the big pieces. We're working on some air quality monitoring on the state level with the Maryland Department of the Environment as well. And like the county executive said, I live and breathe this as well. I drive an electric vehicle. I have solar panels on the roof of my house, and I've done everything I can to kind of live off of the grid. I could go on and on, but with that said, it's probably best if I pass it on to questions, or Lorna, however you want to move forward.
Thank you, Delegate Fraser Hidalgo, as well as Mr. County Executive. Members of the media, we're going to take it in for questions now on the topics of climate and sustainability issues. Tom, I see you have questions. Are they related to these particular topics, or is it something else that we do after the other portion of the presentation?
You should probably take on topic questions then, because I have something else.
On topic. Okay. Any questions on this particular topic, members of the media? For the state delegate and or the county executive? I guess not. Thank you for joining us, Delegate Fraser Hidalgo, this afternoon, and we'll see you soon. If you want to stay, please remain.
Thank you.
Thank you.
Tom?
Okay, then. Oh, that wasn't a long wait at all. County executive.
Laura, don't you want to finish the briefing before you take questions and everything else?
Yes. Questions on other topics and or public health update after the rest of the briefing, Tom.
Tom, I don't want to disappoint you by having the short wait. I want you to get what you expected.
Thank you so much. All right. Thank you, Delegate Fraser Hidalgo, for joining us. Have a great afternoon. We'll see you soon.
Yeah.
Thank you very much.
Thank you, Mr. County
Bye-bye.
Executive. You can continue with the briefing, and Tom will take your questions after that.
So yesterday I was invited to celebrate one of the latest projects in our Satellite Valley. And I know some of you are wondering, Satellite Valley, what do I mean? So like a constellation of stars is made up of a collection of satellite networks and partners clustered together right here. And Intellian is a leading global provider of satellite user terminals and communication solutions. And it has expanded its advanced development center here in Rockville. Company leaders say it will be a place to host a number of top industry engineering talent, and it will bring in this talent for product development. They're all going to be adding about 20 more positions that'll bring their total positions to 60. And I had an opportunity to tour their facility yesterday, and Intellian plans to use the new location to design products that'll enhance their satellite communications presence. And they sell these projects that are being created here to the government and private sector companies. For example, one of the biggest users of their products are the leisure fleets of the large cruise ships, where they're able to beam internet and other services to the ships at sea and maintain a consistent connection while the ships are moving. And where they provide internet connectivity to locations that are also not served by regular telecom equipment beyond those things that are sailing around on the water. Company leaders are really confident that expanding in the new facility here in Maryland is going to allow them to remain at the forefront of technology innovation in the industry. And I want to thank the company for choosing Montgomery County to expand in. I wish them all of the success they can possibly have. On the unpleasant fentanyl area, a lot of energy has been spent this year on making sure parents of middle and high school students realize the dangers of fentanyl and the spike in the number of kids sent to the ER since the start of this fiscal year for drug-related reasons, including overdoses. But it's not just school age kids that are impacted. Health professionals are worried that too many young adults between the ages of 18 and 21 as well are being impacted by this. To help combat that, a new push is being made to take those outreach efforts out into our area college campuses. This Thursday, Montgomery College will host a Narcan training for students and staff on the Montgomery County Germantown campus, starting at 6 p.m. The public's welcome, but anyone planning on attending is asked to please register ahead of time. And the county and our schools are also coordinating on prescription drug take-back programs. Today, 3 prescription drug drop-off boxes were placed at all 3 campuses of Montgomery College in Silver Spring, Rockville, and Germantown. And you can always drop off unwanted drugs by visiting any of our Montgomery County Police Department substations. And this program obviously makes it easier for parents and college students to dispose of those drugs. And we know from the past that unused pills sitting in somebody's medicine cabinet, most often parents, often became targets of curiosity and use by some of the younger members of their families. So if you're not using a drug, get rid of a drug, and we'll help you do that. HHS is working with the universities of Shady Grove to make sure students know about the dangers of fentanyl, and they're registering students now for Narcan training, making sure all the students know that free Narcan kits are available through the mail or by scheduling a pickup time. But I want to be blunt. Narcan is not a cure for addiction, but a tool to prevent death from overdoses if you get it in time. As much as we're encouraging it to be available, people who are using these drugs need to understand that there may not be someone around with a Narcan kit the next time you overdose, and that could have fatal consequences. You can't take this addiction lightly. It can all too easily lead to fatalities. So please, if you're hung up on fentanyl, see somebody who can help you get off it. Be willing to talk about it, because this is not something that you can play with. It's very different than some other drugs that are out there, and you need to be thinking about that. I'm very pleased with the partnerships and engagement that HHS has undertaken over the past several months to increase awareness regarding opioids and fentanyl, and we have to continue these efforts through the summer. On the COVID-19 front, while the community threat is low and there are fewer patients in the hospitals, we're continuing to monitor and be prepared for next potential wave. Remaining up to date on your shots is part of our community preparedness. Over the next few weeks, there'll be a lot of news coverage regarding the end of federal funding for COVID-related expenses. We are already prepared for that. This could cause some confusion amongst our residents about what it means for the resources that we've been offering for vaccines and tests, as well as food donations and rental relief. In my FY24 budget, we've proposed to keep as many of these resources as we can afford. So we've put money into rent relief, and we're putting money into food assistance. We've got money for vaccines. We'll make sure they're available. And we've got money in for testing, but we're not doing it at the scale we were doing it before. Hopefully we won't be driven to do the testing and vaccinate. Well, hopefully you all get vaccines, but hopefully we won't be driven to do as much testing because the cases won't be as prevalent. But on food donations and relief, we put $6 million in the budget. We anticipate that if it gets used up as we think it might, that we can get another $6 million out of our reserves and it won't be a problem. We've put about $40 million in for rental relief. That is less than we were spending under the federal government, but it's about as much as we could afford to put in this budget. So without federal help and without state help, it could just increase the challenges that many people are facing. Free vaccinations and PCR tests are still being offered, and we still have regular appointments Tuesday through Friday at the Dennis Avenue Health Center and the Up County Regional Services Center, as well as other clinics in Rockville, Wheaton, and Burtonsville coming up. Our libraries will continue to offer free rapid test kits and masks. And we're still going to provide, as I said, food resources and some rental relief. Just because the federal emergency may be ending, the need for these resources remains in our community. And we're just not going to turn our backs on the hunger that's out there or refuse to help people who are facing eviction. We we'll do as much as we can, and hopefully, as others see the extent of this problem, they'll be more willing to assist us and other counties in the state of Maryland and in the country, frankly, in addressing this. In other COVID news, mentioned last week, new FDA guidelines recommend a bivalent booster shot for people who are immunocompromised and if it's been 2 months since their last booster. Boosters are also recommended for people 65 and up if it's been 4 months since they had their last shot. Sometime this summer, these guidelines will be reevaluated by the FDA in time for the start of school. As we prepared for the latest round of booster shots, the majority of county residents still have not received their bivalent booster. During the initial rollout of the vaccine, over 95% of our 65 and older population, which is the age cohort most vulnerable to severe illness and death, got their first and second doses. But to date, only 58% of the 65 and older residents have received their bivalent booster. And that's really concerning because this is, it's only 27% of our largest cohort. Our largest cohort between 18 and 49 have gotten their boosters. The senior population really is far more vulnerable. And their population, early on we saw had the most cases and the most deaths, and we don't want people getting complacent about getting the booster shot. The virus has changed. The vaccines are changed. The FDA is, I think, withdrawing approval for the older vaccines, which gives you an idea that they want people taking the new vaccines. So if you haven't gotten the new bivalent boosters, you really should be getting them, particularly if you're immunocompromised or over the age of 65. Earlier this month, the New England Journal of Medicine published the findings of researchers who found that the bivalent boosters were 67% more effective in preventing hospitalizations and death in those who'd been previously vaccinated or boosted. And although Pfizer and Moderna bivalent vaccines were initially designed to target the BA.4 and BA.5 strains of Omicron, they also reduced the risk of infection and hospitalization and death against the currently circulating BQ1, BQ1.1, and XBB and XBB 1.5 strains. There's a new strain that's increasing in prevalence, and we've had a slight uptick in cases, nothing that's alarmed us to this point, but we're all keeping track of this, and we'll let you know as the situation changes. But the best protection against whatever the situation is getting vaccinated. The facts prove these vaccines work, and we need to continue to communicate and engage our public in getting their shots. And we're going to turn this over now to our public health team before we take questions from the media.
Thank you, County Executive. I think the most important message in there is if you haven't gotten your bivalent booster, get it. And those over 65 and immunocompromised are now eligible to get a second one if they so desire. And I will turn it over to Mr. O'Donnell, who will give us our facts and figures.
Thank you, Dr. Davis. So again, just to share with you, we continue to do our surveillance globally, nationally, locally. We have not seen a significant uptick across the globe. There is a few countries who are experiencing greater levels of the XB 1.16. Many of those countries didn't really have as large a surge with the previous XBB variants, and so we're hoping that experience we had over the winter is again offering some protection. We are monitoring these. So far, they don't look like the new variants that have been identified. They don't look like they cause significant illness, limited numbers of hospitalizations they're seeing globally. There is some reports of some itchy eyes, particularly with younger people, related to the 1.16, but we have not seen a huge uptick. We saw a little rise, but relative to where we've been in the past, we're still at fairly low levels. And again, we're not seeing the new hospital new hospitalizations go up appreciably. We're at some of our lowest hospitalized rates, since the beginning of COVID, and we're hopeful that that these variants that we're looking at now won't have that impact. We're always mindful that there could be a new one that presents a little bit differently and with more serious consequences. So we will keep monitoring, and we'll let you know if we see changes. Looking beyond, as I said, there's not a lot of hospital impact from COVID, but just in general, we saw our emergency department visits go up a bit over the last week. You can see there's some lower points there for a while. It's gone up a little bit. And when we look at what types of visits, and specifically if we just look at respiratory, flu-like symptoms, respiratory and fever, we don't see that increase in most age groups, but some of our younger populations, the under 17, that's where there's been some increases. And we know lots of families traveled over the recent weeks as part of spring break. There could be some of that having been passed around both during travel and then as kids return. We just ask families to be cognizant. If your children have these symptoms, please do use a COVID test. They're widely available. And even if it's not COVID, we'd ask that people do wear masks if they have respiratory symptoms to help protect all of our other residents. Again, we've seen the deaths come down quite a bit over the last few months. And in addition to the efforts we're doing at the local level, I'm actually calling in today from Atlanta, where the National Emergency Preparedness Conference is going on. I was just in a session with our neighbors at the U.S. Department of Health and Human Services and the ASPR agency now, and they've confirmed that they do not plan to transition to the private sector until the fall, which means they'll continue to provide vaccines for free to not just state and local health departments, but to pharmacies and other providers, which helps to bring down the cost. In many cases, it's free to be vaccinated, certainly at all of our sites and our partner sites. But there's lots of places where you can get a no-cost vaccination. And we'll continue to distribute those rapid test kits. Our state partners have been fantastic at helping us provide those so that there's less of an impact to our local budgets. And we do appreciate that. And, we want to make these readily available to the community because we do want people to test when they have symptoms. And again, even if it's not COVID, please wear a mask if you have respiratory symptoms or if you have a fever or have been exposed. Those have not changed at all. And again, we are updating our website as new systems change and availability of some things change. There are some state resources which will be changing at the end of the public health emergency or over the next few weeks. We'll try to update our web services to describe where those changes are or where to go. For example, the CDC has not only an ability to find where you can go for no-cost COVID testing, but also if you would like to go to a site, if you're symptomatic, you can go to a number of sites where if you have a positive test at that pharmacy, they can write you a prescription right there. And it really reduces your time. We know there's lots of antivirals available to our community. They're not being used nearly as much as they should be. So please, if you know someone who, especially if they're a senior and they have a positive COVID test, recommend to them that they talk to their primary care provider or talk to a pharmacy about getting a prescription for Paxlovid or something else that might be more appropriate that can not only help them recover more quickly, but potentially reduce the likelihood of long COVID. So with that, I'm happy to turn it over to my colleagues if there's anything additional they'd like to add at this time.
Thank you, Mr. O'Donnell and Dr. Davis. Dr. Stoddard, do you have any opening remarks? No? All right, so we open it up for questions and answers. Tom Fitzgerald, Foxfire DC, you have some questions. Your turn. Thank you for your patience.
Thank you all for the briefing today. County Executive, there was a letter that you received yesterday, we believe, from the Council President, Mr. Glass, claiming that there are 1,500 vacant positions that he's identified and wants an answer from you on Friday as to whether or not these need to be in the budget. Could you address that? Are there positions in this budget that could turn into some cost savings for taxpayers?
Mr. County Executive, you need to unmute. Thank you.
So we've already explained to the council what we were doing, and there is a disconnect between about how we can show savings in personnel. The 1,500 number is real when you knock out public safety in police and fire and the corrections, you wind up with about 1,100. And, this is the first year that we've actually gotten back to kind of like as normal staffing as we can get. And our folks, dealt with about 800 hires last year to replace priority people who were leaving. And we do have a backlog of vacancies. And I've directed the departments to be very careful about what vacancies we fill. We look at this as an opportunity. We've talked with the unions about this to determine where we may not need to replace these positions or some of these positions. It's not going to apply to the police department, the fire department, or corrections. Anything that we deem as an essential service of public safety, the assumption is that we need them. But what we are trying to do is assess if departments are able to deliver services pretty much as normal in the face of some of these outstanding vacancies, then we should evaluate whether we need to fill those positions. So the directions are, if the department has been unable to do something because of a vacancy, they should hire those positions. If they've had to force workers to work overtime, we do, like mandatory overtime and some pretty harsh stuff. If we're doing anything that forces people to work overtime or makes their burdens kind of ridiculous to the point that people are not going to stay there, they need to fill those positions. And positions where they're not sure whether they actually need to fill it right now, we're asking people to take this year to figure out how much you think you're actually going to need to bring back. So I don't anticipate bringing back all 1,100 of the vacancies. I do anticipate that, a large number of them will come back, but it's hard to put a finger on it, and assign a number. So Evan wants a number, and that's going to require kind of consulting with the department heads and also consulting with the staff in the departments who actually have to do the work. I mean, they have a vested interest in this. So we want to make sure we make the right cuts. I had talked about suggesting that we could, do something like freeze and say no more than X number of these funded positions can be hired this year. And I think that's the wisest way to go forward. In other words, to say, if you want $10 million, then assume that 100 positions won't be funded and leave it to the managers to actually pick the positions as we go through the process of evaluating whether they're needed or not. And hopefully we can work out something between the council and us. But we'd had this discussion when I first got on, when I was first elected, and the council didn't like this kind of generic, yes, we'll solve the problem as we go forward approach 4 or 5 years ago. Well, we're at a different time now. And hopefully, we can work with the assumption that we'll leave, a certain number of positions vacant enough that they can count on savings, and then we'll work to achieve that number and hopefully even go beyond it.
If I could follow up,
Yeah.
County Executive, you're a couple of weeks down the road since proposing this budget. Isn't this the kind of thing that should have been looked at before the budget was proposed and the 10% property tax increase was also voiced?
So we did look at it before that, and the problem was we can't make this kind of cut unless the council agrees. Like I said, we went down this route before, and the council didn't want us to do this. If they're willing to do it this time, which I think would have worked before just as well, I'm more than happy to do it this time. I mean, there are some other things that we could do that would reduce the tax burden, but they're things that the council did not earlier support. So hopefully we'll have discussions about more creative ways of doing this. But given the directions and assumptions of the council, we didn't want to put something in there where we'd say, well, these are going to be vacant positions. We don't know what they are, but they're going to be vacant. If that's something they can accept, we can live with the cap on hiring in order to achieve it.
Thank you.
Thank you, Tom. Members of the media, any more questions for the county executive and the other officials? No more questions? Going once? You sure? Going twice?
Can I say one more thing?
Oh, I see that. I'm sorry, Mr. County Executive. So you can say that, and I see your hand up, Marianne.
I just wanted to say real quickly, Tom, I thought that was a really good question because we don't get an opportunity often to explain the nuances of things like this. So thank you for that question.
I appreciate your interest in the question. Nuances isn't usually my thing.
Thank you. Marianne Shahzad, Montgomery Community Media, I see your hands up.
Thank you so much. Good afternoon. So for Mr. Elrich, tomorrow Dr. McKnight is set to give an address about the rise of hate and racism in MCPS, and she's supposed to announce actions that the school district is going to take going forward. I know you've spoken out about that before, specifically anti-Semitism, and I'm wondering if you've talked with her in recent days about the issue and if you have anything to supplement what she might announce or say tomorrow.
So I haven't talked with her since they made the announcement that they're going to do this. And so I'm looking forward to having a conversation, but anything they do is important. I mean, we need a more deliberate policy. We've talked before about, you can't tolerate racist, sexist, homophobic kind of messaging in classrooms. You can't say this is all right. And the school system's got to be unambiguous about that. And these kids need guidance. I mean, and the truth is these kids don't invent this stuff themselves. It's coming from adults. I was a teacher. They don't sit around and say, gee, who can I hate today? They're kind of pointed in a certain direction. And we need to help them understand that they've been pointed in the wrong direction. But that's going to require some pretty firm statements about that. At least that's what I think.
Thank you.
Thank you, Mariam. Any other questions from members of the media? I guess not. We're done for today. Thank you, everybody, for joining us. Have a safe afternoon, and we'll see you next time.
Bye.